Good afternoon, and thank you all for being here. My name is Jeff Schwartz, and I am an advocate for the faith-based organizations we are here to talk about today. Before I speak about the investigation or agencies, I want to tell you why I'm standing here today. My grandfather, David Raznick, was a young Jewish man who fled Poland in 1929 because of escalating religious persecution. He left with almost nothing: the suit on his back, one small suitcase, and his prayer book. The prayer book is what sustained him. It gave him hope. It quite frankly saved his life. I hold that prayer book today. This is a reminder that in America, faith should never be punished. It should never be regulated out of existence. It should never be treated as an inconvenience by those in power. That is why when faith-based behavioral health providers came to me in early 2025 with deeply troubling concerns, I knew I had to act. These organizations serve Arizona's most vulnerable people: children in crisis, families struggling with trauma, and survivors of human trafficking. They serve anyone who walks through their doors, regardless of their background and belief, with compassion and excellence. They do not turn people away. They do not ask you who you voted for or what church, synagogue, or mosque you attend. They simply want to keep on helping people. But they are facing an impossible choice: compromise the very convictions that motivate their compassion, or lose the licenses that allow them to serve. Let me be clear about what these organizations do and do not do. They serve everyone. They welcome all. But there are a small number of specific services they cannot provide or facilitate, only because those services conflict with their sincerely held religious beliefs or fall outside their professional expertise. In those cases, they refer patients to providers who can help. That is how ethical, patient-centered care always worked. A provider serves everyone with acknowledging the limits of what they can personally offer. The patient still receives care, the provider maintains integrity, everyone benefits. These organizations tried to work with the state. Every attempt was rejected as non-compliant. The message from ADHS was clear: set aside your beliefs or surrender your license. Many of these providers were afraid to speak publicly, fearing retaliation from state officials. I told them they should not have to stand alone. If they could not speak safely, I would be their voice. And as you can see, there are no providers here today because of that reason. After extensive consultation with Peter Gentella at the Center for Arizona Policy, we submitted a formal complaint to the U.S. Department of Justice on June 6, 2025. That complaint was referred to the U.S. Department of Health and Human Services Office for Civil Rights. On December 9th, HHS informed us that they had opened a formal investigation on the state of Arizona to determine if ADHS practices unlawfully restrict the Constitution and statutory of religious providers. The federal government reviewed the evidence and found it credible enough to act. That is significant. At the same time, we recognize that HHS has not prejudged any outcomes. This is an ongoing investigation, and we respect that process. But let me be clear about what is at stake here. This is not just about religious freedom, though that alone would be reason enough to raise that issue. This is about access to care for Arizona's most vulnerable children and families. When government forces value conformity as a condition of licensure, it drives out some of the most effective, most compassionate, and most community-embedded providers in the state. These organizations fill gaps others cannot and will not fill. They serve the desperately need help. Arizona already faces a critical shortage of behavioral health professionals. We need to be working to expand access to care, not narrowing it. We need more qualified providers serving children and families, not fewer. To the faith-based organizations across Arizona who have been impacted by these policies, now is the time to be heard. And if you're afraid of retaliation, know this: we've got your back. If you cannot tell your story publicly, we will tell it for you. You should not have to choose between your mission and your beliefs. You should be free to continue serving everyone with the same compassion and excellence that has defined your work for years. My grandfather came to America because he felt and believed that it was a place that faith could be protected, not punished. Where people of conviction could serve their communities without fear. I'm standing here today to make sure that promise endures. For providers of every faith who answer the call to serve Arizona's children and families. Thank you all. I would like to turn over the podium to Peter Gentella, President of Center for Arizona Policy.
Thank you, Jeff. Thank you for your compelling advocacy and your heart to serve in your community. Well, good afternoon. My name is Peter Gentella. I'm the president of Center for Arizona Policy. Today, I'm here to share news that matters to every Arizonan who believes that compassion and conscience can coexist, and that government should protect both. On December 9th, United States Department of Health and Human Services launched a major investigation into a state health department to determine if its behavioral health licensing policies and practices violated federal law by discriminating against faith-based providers. Today, we announced that the Arizona Department of Health Services is the target of that investigation. The investigation was launched because there is evidence that ADHS, the Arizona Department of Health Services, has been coercing faith-based behavioral health providers, organizations that serve our most vulnerable children and families, to abandon their deeply held religious beliefs. Or they could lose their licenses. Center for Arizona Policy filed this federal complaint on behalf of several targeted organizations. These worthy organizations must remain anonymous, but I want to share more about the compassionate, life-giving work that they do. These are not newcomers to our community. These are established, licensed providers who have served Arizona's children and families, many for decades and more. They serve with professionalism, with compassion and excellence. They serve everyone who walks through their doors. They care for trafficked children. They counsel families in crisis. They help trauma survivors heal. They welcome people of all backgrounds, all faiths, and all circumstances. But there are a handful of specific procedures, a small number of services that they cannot provide or facilitate. Not because they want to turn anyone away, but because those procedures conflict with their sincerely held religious beliefs, and they fall outside their professional expertise. This is how ethical healthcare has always worked. A pediatrician who lacks training in oncology, for example, refers a child with cancer to a specialist. A provider who cannot offer a particular service in good conscience refers that patient to someone else who can. The patient still gets excellent care. The provider focuses on what they do best. Everyone is served. That's not discrimination. That's responsible, referral-based healthcare. These faith-based providers operated under ADHS patient-centered standards for over 10 years without incident. They were praised for their work. They filled gaps that other providers couldn't or would not fill. And they served populations that desperately needed help. Then in 2023, the climate changed. What had been acceptable suddenly became unacceptable. Long-standing practices that had never been questioned were suddenly treated as licensing violations. Organizations that had operated with excellence were told, in effect, facilitate these specific procedures that conflict with your deepest held convictions, or we will revoke your licenses. After years of faithful service in Arizona to its most vulnerable children and families, these providers face an agonizing decision. Betray the beliefs that led them to serve or surrender their license and cease offering care. This would mean real children losing access to care, women fleeing from trafficking, finding no place to go, families in crisis failing to find support. All because the current administration decided that compliance with ideology mattered more than compassion for children. It should concern everyone that these organizations find it necessary to remain anonymous. The reason is painfully simple. They're afraid. They have watched ADHS wield licensing procedures as a weapon against providers whose beliefs the current administration disfavors. They've experienced firsthand what it means to be targeted, not for poor performance, not for harming anyone, but simply for holding convictions that powerful people disagree with. Until this federal investigation is resolved and they have some assurance of protection, they cannot risk having their doors closed. They want nothing more than to continue serving Arizona's families, but they cannot do that if they're publicly targeted and stripped of their ability to provide care. The federal government reviewed our complaint. They examined the documents. They evaluated the evidence, and they concluded that these allegations warranted a formal investigation. Let me say that again. The United States Department of Health and Human Services determined that this case is serious enough to investigate. Federal investigations do not open probes on a whim. They do it when the facts demand scrutiny. And here's what every Arizonan should understand. Arizona is facing a critical shortage of behavioral health providers. Children are waiting months to see a counselor. Families in crisis are being told there's no one available to help. And in the middle of this shortage, ADHS is driving out some of the most effective and most compassionate and most community-embedded organizations in the state because they hold beliefs the current administration doesn't like. That is not good policy. It's not good for families, and it's certainly not good for the vulnerable children who are paying the price. Faith-based organizations have served Arizona's children and families with excellence for decades. They answer a sacred calling to help those in need. They do not ask for special treatment. They ask only for the freedom to serve according to their convictions. The same freedom that has been protected by federal law and the Constitution for 250 years. No state agency should force these providers to choose between their license and their faith. That's not regulation, that's coercion. And coercion of conscience has no place in our country.